Hey guys, it's Dr. Justin Marchegiani. Welcome to today's live video. Let's dive in with questions. What is going on, guys? Any questions for today? Hope everyone is doing okay. I just finished a video up on thyroid hormone where we talked about, are you getting enough thyroid hormone? The problem is conventional medicine typically bases that off of TSH. So once your TSH is closer to 1, then typically they give you the thumbs up and you're good to go. The problem is a lot of times you may still have thyroid symptoms even though your lab tests look normal. That's the problem. So in this video, which we'll put out over the weekend or on Monday, we talk about, we have TSH, which is a nice hormone to look at. It's actually a brain hormone, not necessarily a thyroid hormone, but we have to look at some of the downstream hormones. That's very, very important. Okay. We have to look at how you're making your hormones downstream, T4, T3. We have to look at if there's an autoimmune attack at all. And we also have to look at and assess, are you converting T4 to T3? And are there other factors like adrenal health and insulin resistance or other nutrients that are involved in that conversion? And so many thyroid issues are autoimmune in nature. So we have to make sure our immune system isn't attacking the thyroid, because if it is, then our functional thyroid tissue will start to wither away over time as it gets replaced with scar tissue and we have less ability to make thyroid hormone. All right, hope that makes sense. Let's dive into a couple questions, y'all. Dennis writes in, if schizophrenia is due to an abundance of dopamine, then why is it not an enjoyable experience? Well, I don't know that to be the case if it's an abundance of dopamine. I think that may be an effect, not necessarily a cause. Schizophrenia tends to have a lot of genetic components to it, but there's also some association with gluten sensitivity and other inflammation and other autoimmune markers. So I always look at the gut, always look at the inflammation, and I'll look at all the other nutrients to run the brain. I don't think it's a mutual cause that dopamine's high, therefore schizophrenia. I find lots of people that are chronically stressed have very low dopamine, as dopamine gets converted to make adrenaline. So when you're stressed and your adrenals are in overdrive, most people actually deplete their dopamine levels. Josh writes in, a little confused. When supplementing digestive enzymes for H. pylori infection, do I use your Digest Synergy or your Enzyme Synergy or both? It depends. Digest Synergy is kind of a combo product with lower amounts of HCl. And I'll kind of use that as my combo gig for people that have reasonable digestion. If not, we use HCl and enzymes separately. And we just have to be careful because people that have H. pylori may have a lot of gut inflammation and they may need HCl, but they may not be able to handle it, right? It may be like someone that has back pain, but also has a sunburn, so can't handle an adjustment or a massage, right? So even though you need it, you just may not be able to handle it. So we have to look at the whole complete picture and typically lean on more enzymes, fix the diet, pre-digest the food with the cooking methods, and add an HCl as we can. Didi writes in, what hormone exactly will Vitex increase? Typically, Vitex is going to be increasing progesterone. Vitex helps increase LH, which is luteinizing hormone, which then stimulates the ovaries to make more progesterone. So we see more progesterone coming from chaste tree, which is nice. Yvonne writes in, what is a natural supplement to replace levothyroxine? So levothyroxine is synthetic T4. It's T4 with a sodium molecule attached to it. Typically, we'll do something like a Nature-Throid or a WP thyroid or a NP thyroid, or in my line, we use something like a thyroid balance. Those are the big things that we will use to replace that. Elizabeth writes in, hey Liz, I hope you're doing well. Dr. J, my hormone cycle is still regulating, so I didn't bleed this month, but during this time I would have. My breasts became extremely sore and bigger than usual. Any thoughts to as why? Well, I mean, that's just a natural side effect of PMS. So I mean, the question becomes, how is it compared to previous cycles? That's really the question. And if you had more stress or more dietary stress or travel or poor diet, those could always be things that could throw off your hormones. So there could be more to the puzzle than that. I'd want to know more about like what did the last 3 to 6 cycles look like, and how long have you had your cycle back? And then number 3 is any newer stresses that could have come about to become a problem. Hope that makes sense, Liz. Didi writes in, you look leaner. Any new habits? Oh, great question. I'm keeping my carbs a little bit lower. I'm doing a lot more of the bands during the day. So I have my X3 bands in the corner of my office. So I'll do more of the bands. I think that's a big thing. For me, resistance training is key. If I can lift a little bit more, I keep a little bit more muscle on me. More muscle, I think it helps with my insulin sensitivity. So that's a big thing that I've been doing. And I've replaced some of the dark chocolate at night with keto cups instead, which are like 1 gram of sugar. So keeping the carbs pretty low and trying to get a little bit more resistance training in. Thanks for asking. Hope that helps, Josh. Gabe writes in, oxalates, other than reducing sugar, what's the best way to break down oxalates or crystals? Well, we can do citric acid. You can do higher, you can just do like shots of lemon juice can be very helpful. I think also apple cider vinegar can be helpful too. You could also do more potassium and magnesium can be very helpful for breaking down oxalates. And then also just avoiding oxalates too. Trying to avoid the higher oxalate foods. Spinach is a big one, even though spinach is healthy. It's a big one. So if you're doing a lot of spinach, you can switch more to kale. That's a good next step for you. All right, cool. Any other questions, guys? Let me know. So as I was saying with my thyroid hormone talk, it's important that, number one, you look at the thyroid symptoms. And also, we even look at temperature. A lot of times body temperature can drop, and we can use temperature as a good gauge to whether or not you're getting enough thyroid hormone. Susan writes in, I'm struggling with absorption and continuing to lose weight. Should I increase enzymes? Well, I mean, the first thing is most people who are struggling with an absorption and continuing to lose weight, they're just not eating enough, number one. Number two, if you are eating more, make sure you're pre-digesting your food in a crock pot or an Instapot to make it easier to digest, easier to absorb. You're chewing your food up enough. And then, of course, dial in the enzymes and the HCl as needed. That's going to be your best first step. And then if you're continuing to struggle, you can also increase carbohydrates. That way the carbs will help you with a little bit of the weight gain. Carlos writes in, hey, Carlos, is it better to take amino acid supplements away from food or for better digestion? In general, with food is fine and you'll get a slower absorption, but it's still going to get there because the amino acids are all pre-digested. So I'm fine with you taking it with food. No problem with that. But you could also do it away from food too. I have no problem. K Gupta writes in, can you recommend a good brand of systemic enzymes to use them for inflammation or for biofilm busters? Great question. There is a product by World Nutrition called Vitalzyme, ZYM, with the little Enye there. Not Enye, but the umlaut, I think. And there's no E at the end. And that's a good one. That's serapeptidase. There's also Wobenzyme N, which is a little bit cheaper. But I know the Vitalzyme without the E is very effective for like fibroids and helping to digest like cancer cells and those kind of things. So there's some good benefit there, and it helps with biofilms and inflammation. Gabe writes in, can I have a small cyst near my ankle? Best way to reduce it? Well, I mean, what's the root cause of the cyst? Was there any kind of inflammation there from an injury? Was there a bug bite? You could just do apple cider vinegar, like put it in a cotton swab and then put some tape, have it like tape it around that spot. That can be really helpful. Apple cider vinegar can do a lot to help with some of these things. Like apple cider vinegar is like something you could apply to everything. It's pretty awesome. Dr. J, what's the best time to take digestive enzymes and HCl? I typically do it right in the middle of the meal. Some say enzymes before. Enzymes in the middle is fine along with HCl. That way you're not having to remember two different things. I think that's fine. Colin writes in, if TSH was 0.5, but T3 and T4 are on the lower range, would there be anything you would recommend to bump those numbers up? Well, I mean, I would try to bump up my TSH. Now, why the TSH is low, there could be some underlying adrenal stress that could be part of it. So I'd want to work on my adrenals. I'd want to use specific adaptogens to help my adrenals, my HPTA axis, so to speak. And I want to look at all the nutrients that I need to help make good levels of thyroid hormone. Selenium, zinc, magnesium, CoQ10, all those good things. And also make sure autoimmunity is okay. Dee writes in, GABA, best up for it. I feel like I was born without enough GABA. So of course we can do magnesium to help with GABA. We can take actual GABA. Some say liposomal for the absorption, and then L-theanine as well. L-theanine, GABA, liposomal, and magnesium are going to be great. You can also do things like valerian and passion flower. These are great on the herbal side to help upregulate GABA as well. Sarah writes in, is it true that before you can successfully get rid of Candida, you have to kill parasites and lower your heavy metals? I typically say no, but I would address bacterial infections, parasites, and yeast all within a 60 to 90-day period. And typically I go after heavy metals after, because so much of heavy metal detoxification happens through the gut. So I want healthier gut function before we go after heavy metals. Alma writes in, what are the best enzymes for fat malabsorption? Well, of course, we would throw in bile salts, which aren't necessarily enzymes, and then a lot of lipolytic enzymes, which are going to be various lipases that help with fat digestion. And then typically we would throw in proteolytic enzymes too, so a combination of those. But we may need extra bile salt on top of lipase just to ensure that there's no problem. So if your stools are floating or kind of gray or blonde colored or leaving streaks on the toilet seat or on the toilet paper, then that could be a problem. That's a good sign that there's fat malabsorption. Kelly writes in, having a little itch on the GI clear, is it normal before seeing some improvement? Thanks, Dr. J. Yeah, it can definitely happen. That's a sign that you're killing yeast and parasites. You can also increase a little bit of the carbs while you're doing that to help kind of bait some of the critters up, but that can be normal. You can also try doing some extra binders to help bind some of it up as well, if that's a problem. Hope that helps, Kelly. K. Gupta writes in, how accurate is the GI map test for SIBO and Candida? It's going to be pretty accurate, but I mean, Candida is hard to test. So we always look at the organic acids to look at diarabinitol as well. And we'll never see SIBO, but we can see a lot of bacteria on that stool test that may correlate with SIBO. The best way for SIBO is the breath test, but we can get enough indication on the GI map and looking at the patient's symptoms that SIBO could definitely be part of the problem. Liz writes in, the book Woman's Code suggests not having sugar or carbs at night to keep blood sugar balanced. What's your take? I mean, it depends. Like refined sugar and lots of excess carbohydrates at night, I think is a pretty good thing overall. There is some data on carb backloading that the best time to do more carbs, and again, that's not refined sugar though, is going to be at night because we're more insulin sensitive. Again, this is kind of contradictory, but there's a lot of sources that say that, number one. And number two, it really depends if we're sleeping or if we're waking up in the middle of the night. It may be a good idea to have more carbs in there just because I've seen that become very helpful for people that are waking up because of low blood sugar. Colin writes in, thoughts on why SHGB is always through the roof on testing with other sex hormones being in healthy range? Hard to say. I mean, SHGB kind of is a way of regulating hormones. So if hormones are higher, your body may bind some of them up. It's just kind of a self-regulating, self-governing type of physiological capacitor, so to speak. But hard to say on that. It just depends. If it's a little high, I'm not really worried about it. Thoughts on cyto detox? Not sure. Need to know more about it. Follow-up question, are there any drawbacks to many digestive enzymes or is it a net positive? I mean, it depends. I mean, I take enough digestive enzymes or acids to support your digestion and that's it. That's the key. The goal is that you're using enzymes and acids to support your ability to break down food. So food's not sitting, putrefying, fermenting, or just malabsorbing. So it's all a matter of dose. Ashley writes in, what are the supplements that you take daily in order to stay healthy? Well, for me, I do some adaptogens depending on my stress levels. I'll do additional B vitamins and mitochondrial nutrients. I'll also do a high quality multi and fish oil and cod liver oil. And then I'll also take various brain amino acids. And then I do testing, quarterly or every 6 months to assess my nutritional needs. So I kind of fine tune things as I go. Great question, Ashley. Michael writes in, how often should I take an enzyme or HCl with each meal? But it depends. If your digestion's reasonable, maybe just as needed, maybe bigger meals or when you're just more stressed. What would cause dark green stools? Dark green stools can be caused by faster BMs, faster transit time because the stools have less time to, the stercobilin in the stool is what gives it that brown color, and that develops through longer transit time. So if it's really, really short, that could be why the stool is greener. Could have also just drinking a whole bunch of green smoothie or green juice, and the fiber from that can kind of leach in as well. Very possible. When talking about magnesium, there are so many different ones. Which would you take for inflammation? I mean, you can do glycinate, you can do malate, citrate. All those are pretty good. We did a podcast on that recently, so I'd recommend seeing that podcast. Elizabeth writes in, I'm currently on detox aminos. Are there something else I can take every day for the rest of my life to stay clean, especially since I live in a city, or no? I mean, I think the big thing is just making sure you're eating and digesting your protein. I would make sure that you are getting good B vitamins in there. I'd make sure you're managing your stress, you're drinking enough water, and you're digesting your food. And those are the big things that you can do. Now, in general, if you're getting exposed to things, you could always do some glutathione, or you could always do some extra sulfur amino acids if you think you're getting exposed to things. Those would be kind of more acute things. You can also kind of throw some of these detoxification supports in there, maybe every 3 to 6 months. Take some to support these things, and also some good sweating. Sweating is going to be really helpful. So using an infrared sauna, all those are excellent. Jan writes in, what's your take on moringa as an all-around boost for the whole system? I did a article on this, so go take a look at my blog on this from earlier in the year. Sarah writes in, what brand of clean body wash and shampoo do you personally use, and any other? So for body wash, I typically just use a brand called Desert Essence, and I use their coconut shampoo, and I use that just as a body wash as well. For skin, I use the Marie Veronique line. They have excellent skin products. And then Desert Essence is just really good. And then if you're like bars of soap, Dr. Bronner's makes really good bars of soap. Gade writes in, you mentioned not having spinach too much because it contributes to oxalates. What if I have it in a smoothie? Does blending it break down oxalates? Only if you blend it after you steam it, that will reduce them. I still have spinach. I'm not like away from it, but if you have oxalate issues, then you really got to be careful of spinach. So I don't have an oxalate problem. So I do have it a little bit, but I keep it in mind that it is high in oxalate, so I don't overdo it. So just keep that in the back of your head. Roxy writes in, hey, taking detoxidine, organic iodine. I'm taking selenium and zinc and minerals for good diets. I have low markers for Hashimoto's. Do you think the iodine is okay? It depends on how much you're taking. If you're taking it within, 1 to 10x of the RDA, which is like maybe 150 micrograms to 1500 micrograms, it's probably okay with those other nutrients present as long as the antibodies aren't out of control. Kigupta writes in, can someone have both SIBO and Candida? Yes, and they can have other infections too. Very possible. Yvonne writes in, love all the advice. Thanks for your knowledge. You're totally welcome, Yvonne. Kigupta writes in, what's the difference between SIFO and Candida? Very similar. Candida, SIFO is basically small intestinal fungal overgrowth. So that's basically it. Candida is one of the main types of fungus. So Candida elevations and Candida could be part of a SIFO type of situation. Delty writes in, tips for low FSH and high prolactin. What could cause it? What could be used to improve it for a male? Well, a lot of times dopamine is a tonic inhibitor on prolactin. So improving dopamine through amino acids can be super helpful. That would be helpful. And then supporting the adrenals can make a big difference. And then using certain adaptogens, mucuna, ashwagandha, all those things can be helpful. Making sure insulin's in control as well. Elizabeth writes in, is it possible to completely cure tinea versicolor? My boyfriend's dermatologist told him it's something he'll have forever. No, I don't necessarily agree. You can definitely get rid of it. It just depends upon how significant it is. So you can do some of the soaps that I mentioned, like the ART or Purely Northwest, some of the really good herbal soaps. That's really good. Number 2, you can also kill it from the inside using probiotics and then herbs. And there are some medications. So if he's having a hard time, I mean, you could do things like Nizoral or Tinidazole or Head and Shoulders, like the selenium hydroxide type of shampoos. Those could be helpful topically. Fluconazole, ketoconazole. So some of those are prescription based. So you want to talk to the dermatologist and kind of use those, let's just say, as a last resort and do some of the natural things that don't require a prescription first. Didi writes in, DHEA makes me angry, but 7 keto DHEA makes me happy and energetic, but gives me acne and more body hair. How come they're totally different? 7 keto DHEA is like a little bit more downstream, so it is less likely to convert to testosterone. That's the big thing. But regarding the DHEA, it's all about dose. So I always do very, very low doses, like anywhere between 6 to 9 milligrams a day. And if that's still causing a problem, there could be some detoxification issues. Any downside to having breakfast green smoothie every day and with healthy fats and proteins in the form of avocados and pea protein? Nope, that sounds like a really good breakfast. Yep, good fats, good proteins, and even someone that's vegan could still do a good breakfast like that too. Excellent. All right, guys, I got a patient. I got a roll. Hope you enjoyed it. If you did, smash that thumbs up button. Give me a share. Put your comments below and hit that bell for future notifications. All right, you guys have a phenomenal weekend and take care. Bye now.